will activate the video. Ladies and gentlemen, hello and welcome to this webinar, which is the second one organized by the AmplifyPF project, which is funded by USAID, and it is implemented by the Pathfinder NGO in collaboration with Population Council in Burkina Faso, Côte d'Ivoire, Niger, and Burkina and Togo. To tell you more about it, the overall theme of these webinars is about adaptive management of high-impact practices in various contexts. After Burkina Faso, the webinar took place 4 weeks ago about the contribution of non-governmental health facilities in the offer of family planning services, and this one is about Niger. The theme is a community-based approach of mobilization of domestic resources by the technical committee to support integrated learning network for the benefit of healthcare facilities. As a moderator, I'm happy to present Dr. Sani Aliou, experienced physician who has more than 30 years of experience in maternal health and public health, and more specifically, mother and child health. Dr. Sani spent half of his professional time in Niger, where he was born, and also in other countries of Africa from West, East, and Central Africa. Dr. Sani, you have the floor, and you will be the moderator of this webinar. Go ahead. Thank you, Nathana. Hello to everybody. Good afternoon, good morning, depending. I'm very happy to be the moderator today, as my colleague indicated, and I will introduce also another colleague later. As you know, in our countries, right now we are facing major problems, especially the shortage of funding and resources, and it is difficult to resolve even small problems that could be really difficult to resolve in our communities, and we have to think about ways to help our communities to support the system. Until now, we have had an informal system of support by communities, but this project is aiming to integrate this domestic resource mobilization, local resources, in order to implement what we want to do in several countries. This project, the second goal of this project is to get population communities involved and mobilize domestic resources to strengthen the system and enable family planning to be used more widely. This project developed a community-based approach, which I just mentioned, and it means that we try to get stakeholders involved together through what we call a technical committee of support of integrated learning network to mobilize resources to improve work conditions of the health facilities. And we try to make sure that the communities support the system. So this webinar will mention some of the results of this advocacy action led by technical support committee that we call CTARs, by the French acronym, and it has been doing some very useful work in several health facilities. So I would be happy to be the moderator, and my colleague Stefan, who is an expert in the development of programs and projects, will be with me too, and he was in charge of the preparation of this project, similar project 5 years ago. He has more than 40 years of experience in development actions, and he has worked on the management of programs in more than 25 countries in Africa. Steve knows very well the regional health system in West Africa, especially, and he has been directly involved in the implementation of previous programs with the same goals. A number of programs from USAID in the West Africa region, including the SFPF project, which had several phases. So Steve is also developed a regional growth strategy in West Africa, French-speaking French Africa, and he was involved in the start of all programs in Côte d'Ivoire and Niger. He is involved in domestic resource mobilization in West Africa with Pathfinder. So we are going to start with a presentation by Dr. Assama, and then there will be a video that you will see, and then the panelists will take over. So the presentation will be made by Dr. Assama, who has a specialist in pediatric care, but has 30 years of experience in public health, and he has also experience in family planning and management of health programs. He masters the Niger health system. He understands it very well, and he has occupied very important roles at the national level in the General Public Health Directorate of the Ministry of Health, the Directorate of Mother and Child Health, and he also worked at the Health Minister to try to reduce the maternal death as a result of deliveries. And he has been in charge of the Amplify project in Niger. So without further delay, I will give the floor to Dr. Assama for his presentation. Thank you. Dr. Assama, you have the floor. Thank you, Dr. Sami. And I'm very happy to share with you the community approach of domestic resource mobilization by the Technical Committee for the Support of Integrated Learning Network for the benefit of the healthcare facilities of the intervention zones. The presentation plan will be articulated around 7 issues. We'll present first the context, then the definition and responsibilities of the technical committee, the implementation process, the key result, advice for implementation, the cost of implementation of CTAR, and lessons. This project is a regional project of family planning and reproductive health organized by USAID and implemented by Pathfinder in 4 countries of West Africa, including Niger. It contributes to reaching the goals of the Ouagadougou partnership in fields of quality of FP services, also development of high-impact practices, work on postpartum and delegation of tasks in family planning. Its approach is based on the implementation of a integrated learning network since 2019 in Niger, in 5 healthcare districts. So it started, as I said, in 2019, including 3 in Niamey region and 2 in the Zinder region, Zinder city and Myria, with focus on mobilization of domestic resources. So what is this CTAR, technical committee? In Niger, in every healthcare district, we have a committee with more than 60 members, which manages the support of family planning expansion. But the CTAR has been helping, especially mobilizing internal and domestic resources. It has 12 members, and it's based on the specificities of each healthcare district, but it helps the district committee to develop a work plan and a monitoring program, and is used as an interface between the various stakeholders in the healthcare field. And now, a few words about its composition. It has most of the representative of stakeholders, of people who can play a part in mobilizing domestic resources, and its chair, it's the head doctor of the district. What is the process that we use to implement those CTAR committees? First, we started by giving advice to the members of the district health committee about the goals and presenting the strategy. And then we organized a general assembly of stakeholders, and we developed some training activities and helped develop a system that would enable everybody to work together to reach the goal of mobilizing domestic health resources. And we organized the election of the member of CTAR. Then they were presented to other stakeholders, and this document was formalized, and we helped the first meetings to develop its action plan and strengthen the capabilities of its members in the development of community dialogue, and we developed an advocacy for the use of local resources for family planning. This committee has led several activities in the field, including going to public sector health facilities to develop a census of priority problems and develop a plan to mobilize resources. And there was community dialogue and also visits on the ground. And then it reported to the National Health Committee. It developed an advocacy program for this funding of family planning and reproductive health with other partners and the representative of the various towns, and it strengthened the mobilizations of stakeholders. What are the results? First, regarding health in healthcare facilities, the CTAR improved the work environments in health facilities through a number of activities you can see here listed, with the help of the town hall and city organizations to mobilize communities to improve the work conditions of health workers. Regarding the use of equipment and medicine in this health facility, we use all this equipment that we see listed here, not only medicine, but all kinds of equipment that are useful for health professionals. Regarding the rolling equipment, the advocacy we did enabled the healthcare facilities to get more ambulances and also to buy spare parts for equipment and ambulances. Regarding the equipment, like plumbing, for instance, for the healthcare facilities, the advocacy we did helped to improve the situation by more air conditioners and fans and all kinds of lighting equipment, especially also to provide facilities for housing health professionals, and it was 120 million francs. Overall, when you look from 2021 to 2023, the mobilization of resources that have been done in our 5 intervention zone, we were able to mobilize more than 180 million francs. So this was very helpful, and especially you see the numbers, the breakdown for the various intervention zones here. But you see in each zone the amounts that were used. We have 4 funding sources.
So the contribution is, so we basically worked with 4 sources of financing: companies and business, individuals, city halls, and also communities. This approach was very interesting to many partners, and we replicated the model with Impact 2 platform in Madawa, in Ottawa, in Madawa region. 2 candidates for replication of the model. We got Population Service International, PSI, in 3 health districts, and also MIR in 6 health districts. So what are the tips for implementation? So we want a better and improved approach with the establishment of different criteria for CTAR membership, but also the identification and influential people for those health areas, but also the involvement of mayors to make sure that this approach is sustainable. What is the cost of setting up a CTAR? 3,206,000, but it's basically the capacity buildings that enable setting up, but it's basically the orientation, the general assembly, and the training. So what were the lessons learned? What worked well? Guided tours coupled with resource mobilization advocacy, but also the identification of potential partners in the ICS health area, and also leaders, conducting visits to all the health districts to identify operational issues, and also the setting up follow-up committees for resource mobilization plan after each tour. So the commitment of CTAR members is a key element to help communities contribute to improve work conditions and health services in those health districts. And another key element is accountability, which shows donors how the contributions are being used. So what is to be and what needs to be improved? The documentation and sharing of results of practices among the different CTARs, but also the mobility of different players, and of course, the organization of mobilization roundtable for resources. 3 main challenges were identified: ownership of CTAR activities by the communes after Amplify family planning, reduce also the mobility of DCs and CSI leaders, but also the mobilization of more partners to scale up this great practice. So ladies and gentlemen, this is what I wanted to share with you today, and I thank you for your attention. The floor is now yours. Thank you so much, Doctor. So before giving back the floor to the moderator, we are going to show you a video. It's about 5 minutes, which is going to support this presentation and is going to show through different testimonies how this AmplifyPF has implemented this innovating approach to mobilize local resources. It's happening in Niger. The video, please. Go ahead and play it. In rural areas or in urban areas. Reproductive health is a right.
Des problèmes d'entretien dans nos structures. Il y avait un problème d'accueil, une insuffisance.
So please read the subtitles for the translation.
Et il y avait des gaps de certains matériels techniques au niveau de ces structures.
Le CTAR, c'est un comité qui amène un appui dans le cadre de santé, plus précisément sur les PF. Les activités menées par le CTAR, c'est les dialogues communautaires, la visite guidée, les plaidoyers.
Le CTAR est composé de membres de la communauté, à savoir des représentants des structures féminines, des représentants des ONG et associations, des représentants de la tutelle même au niveau de la mairie, le COGES au niveau des CSI et plus le COGES au niveau du district.
Le CTAR a aidé le service de santé à mobiliser des ressources. Il a rencontré la communauté, il a rencontré les services de santé, les agents de santé. On a dégagé tous les problèmes que rencontre le service de santé par rapport à l'utilisation des services de santé de la reproduction. La population a bien compris les enjeux de ce projet. Elle a mobilisé même des ressources, elle-même la population, pour que le service soit utilisé et que l'impact soit positif.
Les relations de CTAR sont visibles à l'œil nu. Si je prends par exemple le CSI Routgouna, le CSI Bilmari, il y a la clôture, par exemple, qui ont été faites en matériel définitif. Il y a les ambulances qui ont été données un peu partout. Tout ça, c'est les plaidoyers du CTAR.
On a eu de bonnes volontés qui ont contribué, qui ont amené du matériel tel que les tensiomètres, les balances qu'on a eu à travailler avec. Une bonne volonté a construit une maternité flambant neuve de plus de 10 millions.
Vraiment, beaucoup de choses se sont améliorées. Il y a les femmes qui viennent, il n'y a pas de rupture. Et puis vraiment, notre matériel est bon. Ils nous ont amené tout.
Alhamdulillah. Aiman du masalan da bunkun iguyo gogobori igubal ku bayni kana kamata ngaiga
daukan maganin hutu da muke zawa ana kwatanta mana sai an waye mana kai kafin ma mu je mu gare shi kuma ga kayayyaki na aiki sosai wanda a da babu su amma yanzu muna da su komi ba he mun je ba can da ko wannan karan damtse mace in tana so an tura ta murya ko da magaran a sa mata.
Amplify a apporté en tout cas des activités à haut niveau d'impact. On va les pérenniser. Nous, on va programmer des activités du CTAR dans nos plans d'action annuels.
Nous allons ensemble avec les membres du CTAR nous réunir très bientôt pour déterminer quel est l'appui nécessaire que nous allons apporter pour leur permettre de continuer leur travail.
Merci, modérateur, à vous.
Moderator, the floor is yours. My name is Stephen Redding, and I will be the moderator today. And today it is our pleasure to host three panelists who are deeply involved in the resource mobilization through CTAR in our project in Niger. So we're going to be asking a few questions to these three panelists. I'm sorry. Let me restart, and then we'll get the answers, and then we can move on to the debate after the panel answers the question. So first of all, Mrs. Baba Zinabou, Miss Niane 5, who was key in the CTAR activities. We also have Saloum Mayama, Chief District Niamey 1, and Mrs. Mariam Maya Bangombo, who's member of CTAR in Niamey 3. So first of all, Mrs. Bama Zinabou, first question is for you. How does the City Hall contribute in the local resources for CTAR? Can you hear me? We can't hear you. You're on mute.
Voilà.
Perfect. Thank you very much. Thank you so much for giving me the floor. The City Hall supports the CTAR and in its activities with guided visits and training visits as well. So the City Hall sends out somebody to represent it.
Okay.
Very good. So for hygiene and cleaning, so the City Hall is always proactive in the way it mobilizes the population. So for example, during health days, so basically the City Hall is at the head of everything, but also for the purchase of hygiene products, it's always the City Hall. For any cleaning, for the septic tank, it's always the City Hall. So we always constantly work with CTAR and their activities. Thank you so much, Madame Zinabou. The City Hall works closely with the health system in the city. So now we're going to give the floor to Sayou Mariamam, head physician, for the next question.
Comment appréciez-vous, Dr. Mayama, l'appui du CTAR à votre district dans la mobilisation de ressources? Dr. Mayama?
Dr. Mayama?
Merci, Stéphane.
Thank you, Stephen. I am Dr. Sayou Mayam. Can you hear me? Yeah. Hello? Can you hear me? I have a bad connection. Can you hear me? Yes. Yes. The connection is bad.
Allô? Ok.
Hello?
La connexion, elle n'est pas bonne, donc je vais
The
faire.
connection is not good, so I will speak fast. I'm Dr. Samuel, in health, head of the first health district in Niamey. The support of CTAR in our district is considerable. It's very positive. The CTAR is one of the major innovation made possible by AmplifyPF in our district, and I'm very happy to say it. CTAR, if I can tell you, like 3 or 4 years ago, in the Niamey 1 health district, we never managed to mobilize sufficient funds, and in order to get resources, I really had to go to knock on many doors. But today, thanks to CTAR, we received many benefits for some districts of the Niamey area. I don't know about the others, but in the Niamey area, I know that the districts which don't have a CTAR are having a hard time mobilizing resources. And so I only appreciate the work of CTARs. Another positive thing is the improvement of our collaboration with City Hall. Before the CTAR, City Hall, I know we are one of the healthcare facilities controlled by City Hall, but the support was very limited. But now the support of City Hall helped us improve our global approach, overall approach. And now we are able to use the work of various stakeholders as well as we can. And the CTAR has made it possible to improve this collaboration in our work environment. So also thanks to CTAR, the advocacy from AmplifyPF helped us to acquire more resources. And this advocacy is much more powerful now with the help of CTAR. And we organized several activities that were very positive. I also can mention, for instance, the renovation of some of the facilities. And now there's more visibility about our various health facilities. We have been able to build more equipment and help take charge of people who are sick or needed medical assistance. And this has been made possible by the advocacy that we have performed. We have had activities for health in the acquisition of technical equipment that we could give to our healthcare facilities was very helpful. So there are just a few examples. There are many more advantages and benefits resulting from the implementation of the work of the CTARs. And thanks to the increased visibility and guided visits of people who saw the reality of our healthcare facilities, they understood the problems related to family planning and increased its visibility. So many stakeholders have been made aware of our problems and what can be done by using domestic resources to help. And so we have become much more efficient thanks to this mobilization. This is what I wanted to say in a few words and to show my appreciation for the work of CTAR. Thank you, Dr. Mayama. So you saw the many different things that have been made possible thanks to CTAR, as Dr. Mayama mentioned, which are the result of resource mobilization helped by the city and also especially with the control of the deputy mayor. And now we'll talk to a member of Niamey CTAR NAME 3, Madam Mayama Gambo. And the question I want to ask her is, how do you manage to mobilize so many funds for the local healthcare facilities? Dr. Mayama mentioned many activities. How do you manage to get funding for that? Thank you. Thank you to give me the floor. I'm Dr. Mayama, and I work for the NAME 3 CTAR committee. So how do we mobilize funds? It is very easy to explain. After the experience we have had, we started by first visit all local healthcare facilities of the district. And after these visits, in order to detect, to detect the various problems, professional problems of the healthcare facilities and operating problems, especially. These operating problems that we detected helped us understand and develop plans to mobilize local resources that we submitted to City Hall in order to help us work with City Hall and benefit from their assistance. And also the next stage was to organize guided tours, guided visits throughout the district in all the integrated health centers of the district. And we talked with all the people in charge of these integrated health centers. And the previous presenter talked about all the kind of things we have done with the CTAR. And these guided visits have been very helpful because we could understand more who could help us if there was more funding coming from domestic sources. And this guided visit enabled us to understand the context, the situation of each healthcare facilities. And there's even someone who showed us, for instance, the bed for deliveries in the maternal health center, and we saw the equipment, and the person in charge showed us the problem and the shortages of equipment, and he wasn't very happy. So we decided to act to provide what was missing, because there are many problems. But also the shortage of resources was manifest in many health centers. And so we got a list of what we should do. And we have developed advocacy. And this method of work, we do it along with local district leaders, especially, again, the integrated health centers. And we worked, we did some visit with the deputy mayor and other officers from City Hall, because once the deputy mayor or the mayor has came to visit this health center, then the local City Hall officers understood and were given instructions to act, to be in charge of this or that, this problem, that problem, and so on. So we have several methods that enabled us to mobilize resources. Thank you. Thank you, Mrs. Mayama. That it was a very detailed account on the various tools that are being used to develop advocacy with City Hall and the population communities and local funders in order to obtain funds to subsidize activities. And now we are going to end this part of the panel by going back to Dr. Asma. And there's a question for you, Dr. Asma. Which aspect is the most interesting for you in the work of CTAR about resource mobilization? Thank you very much. Yes, there are many aspects that I could mention. The first one is availability of the members of CTAR. That's a very important aspect because 3 years after the start of implementation, the rate of participation of CTAR members is more than 80%. So as soon as there is a group connected with WhatsApp, for instance, the members get mobilized to come to meetings or to talk about the advocacy issues. And this availability that I think is great. And sometimes when there is a meeting of a committee, people stop going to the meetings of the committee, but CTAR is different. People have been very involved and have made themselves available. The other element I want to mention is involvement. When we started the process, we went with CTAR members into meetings, but starting on the second year, we didn't go as often to those meetings, but we noticed that the members of CTARs got organized and scheduled their own meetings and were very involved. And I want to thank the members of CTAR for that. They were available for the implementation of the process and the monitoring of the activities. Another thing I appreciated too in the work of this committee is people were transparent in their activities and assumed responsibility. When they did advocacy for something to obtain support or funding, they worked as a team, and then they gave feedback to the people or organization who gave money. So we told them, this is what we have done with the money you provided. And that was very important. And the CTAR did a very good job in that. Thank you. Thank you, Dr. Asma. Now I will give the floor to the co-moderator, Dr. Sani Alio, to keep asking questions to members of the panel. Dr. Sani. Thank you, Stephen. So now we are going to start asking a second series of questions to panelists. I want to go back to Dr. Salum Mariama for the District 1 in Niamey. This question was mentioned about the sustainability of the CTAR. Doctor, do you have a strategy to help CTAR keep working after the end of the Amplify project for the benefit of local communities? Thank you, Dr. Sani. Interpreter apologizes, but the sound is very bad. There's a sound problem here. There is a strategy to have to develop to make this work sustainable. And the first thing we should do is to organize, to take into account what CTAR can do for high impact practices. And I take an example from last year in 2022, during the review of the activities of the 2022 PRR, we noticed what the key performance indicators were. And there were many questions asked in this respect. And so there are partners which are very interested and involved in this various things that we have done through the work of CTAR and the key performance indicator.
partenaires pourront prendre.
So I remain convinced that these partners can take on these activities. The second strategy So the second strategy, I think we're having a video issue. No, we cut off your video because you're having bandwidth issues. So the second strategy is to talk with the City Hall and to foster their support in terms of advocacy. So we need to thank the City Hall for their collaboration. 3-4 years ago, the City Hall was not involved at all, but thanks to CTAR, now because we have members of the City Hall in CTAR, now we give directions to partners to support us in mobilizing resources and also provide certain actions. So great support here. And thanks to their support, when during City Hall meetings, some activities are cited and supported. So those are the two strategies that we want to implement to make this project more developable. And of course, thanks to advocacy, we work with different partners to support differently the actions of CTAR. Thank you so much. Doctor, you're on mute? Now, let's come back to Maria Makambo, District 3. Do you think members of CTAR will be able to keep working on resource mobilization after the end of the project? Thank you. Thank you for this great question. I was expecting it, actually. You know that you get hungry when you start eating. And now, members of CTAR, we realized the impact of our support in the way those integrated health centers worked. And the visits, the guided visits, the advocacy, and how these advocacy plans are set up, or the resource mobilization plans are set up. We now know that we can work with the City Hall, but other partners to mobilize resources. And they can react to it, and we are proud of the results and the results that we will observe later. I'm sure that CTAR will be able to continue their work after Amplify. Thank you so much. It is encouraging to hear your words and great conviction. Let's come back to the Vice Mayor. How could we do so that City Halls keep working with CTAR after the end of those projects? You have the floor. Did you hear the question? Yes. Can you please ask your question again, please? In your opinion, how can the City Halls take on the operations of CTAR after the end of the project? We will continue advocacy work with this central City Hall so that we have the budget to do so. CTAR has significantly helped the CTAR in its daily operations. So we will continue the negotiations. And so we want to include it in our document number 4. Thank you so much. Thank you so much, ma'am. Do you want to add anything? Or are you done? Yeah, I'm all set. I'm all set. Thank you. Thank you so much. Many questions were asked in the chat box. I'm going to Dr. Asama, one of the questions was about the mobility of the executive team. What are the reasons behind this mobility? Dr. Sarum Mayema, how do you select the CTAR members? And how do you identify other companies with whom to do advocacy work? And second question for Dr. Asama, are there any other elements to explain the gaps between mobilization for CTAR? Let's start with Dr. Asama. Thank you so much for these questions. So regarding the first question regarding mobility, I wouldn't know how to explain it, but we realize that in the 5 health districts in which we worked, there's only one head physician who hasn't moved, who hasn't. I'm not thinking of the other health integrated health centers. So this is not necessarily related to Amplified, but maybe it has other causes. In Niamey, the head physician, we worked at first, I think it worked for 3 months, and then there was another one. So big turnover. And this turnover didn't help things. And the second question is about the difference between the different players. So the Myria Health District has the largest mobilization of resources. Myria is considered a rural area. And there was a contribution of many people living there who gave funds, including somebody specifically who invested in the health district, especially ambulances, but also he built every time he really resolves a lot of issues by providing funds. So it's the difference between CTAR in rural area and urban areas. But very often we're talking about individuals. In Niamey 5, it's an individual that made the difference and who renovated integrated health centers. And every time we need something, we present him with a project and he helps us. Some CTARs were a little bit lethargic and took time to pick up. They didn't do advocacy work. And when we did review work, we presented the results to everybody, and it sort of was a wake-up call for all of them, and encouraged them to work a little bit on the advocacy work. So that's how I can, and that's how I will answer those two questions. Thank you very much. Dr. Esma, there's also a question which is related to what you just said on the how. Why are there more mobilization in specific districts and not others? Why are there so many gaps? Why are there so many differences in resource mobilization depending on the districts? That's what I just said here. There are differences because in some health districts, the difference is basically based on individuals. There are influential people that are affluent, and they're ready to finance the health system. In Miria, I'm not going to name names here, but we look at what he did every time we showed up for advocacy. And I just said it, 50% of ambulances were financed by that person that I'm not going to name. So every time CTAR shows up with an issue, it's almost 100% guaranteed that this problem will be guaranteed by that individual. It's the same situation in Niamey 5, and I'm not going to name names. And that person contributed over 50% of the funds needed for CTAR, and has been responded positively to any request with all the problems. So those are my explanations. And not to mention the districts that are a little bit more lethargic. It took them some time to go out and do advocacy work. But once they received the results, when they were shown the results, they basically woke up, so to speak, and they went out and started working on advocacy because they saw the results in other districts. I hope you got the answer. Yes, thank you so much. A lot of questions in the chat box about the durability of CTAR and mobilizing resources in the different districts. And I want to ask this question to Dr. Mariama, who talked in the movie, in the little video, about the sustainability of mobilization resources. Is it something that you're willing to elaborate? How are we going to institutionalize these mobilization of resources? How will they be institutionalized? Thank you so much. Good evening again. And thank you again to Dr. Sani. I will answer first the two questions that were asked by Dr. Sani, and I also some in the Q&A. The first one is about the choice of the CTAR member. In Niamey 1, we sent out a letter to the different representations. So, for example, to have a representative in the young generation, we sent out a letter to the president that represents the young. So, and we said this is exactly the profile of the youth that we would like to represent. For the female representations, we did the same thing. We also they would basically send a customized letter with and they provide us with a representative with a name of somebody who would represent their group. So this is how we did it.
Voilà, on a invité le maire sur la personne qui peut
We
représenter.
invited someone representing the mayor of the city, so that that person could be available at any time to accompany us if we needed help. And there was a question concerning the choice of stakeholders for the mobilization of funds. With City Hall, since our collaboration was improved with City Hall, a representative of City Hall comes with us, along with other partners who work in the health field. And it varies depending on the situation, but in the Niamey 1 health district, we worked in several partners, and representatives of various local organizations were coordinating our work. And we talked about the concrete issues that we're facing. And those people got to understand our problems and started acting in order to resolve the issues. And one of the results, one of the outcome, like for instance, when we have a visit, we invite influential people to come visit healthcare facilities, and they understand our day-to-day reality, the daily work, and they always react when we see a table, a room, there's a shortage of basic equipment. Well, it is very important to ensure the health of women and mother and children. So they understand the problems and they start acting. So there are a number of representatives of the public sector, the City Hall or the ministry who come, and they come to see what is happening. And there are also representatives of organizations from the private sector, small and medium-sized companies, who come and help us renovate the structures of the health facilities. So this is what I can say to answer these questions that were asked. Thank you, Dr. Mariama. Dr. Sani, are there other questions? Oh, yes, go ahead. Yes, we have other questions, but we have Dr. Sumana who raised hand. Can we, hello? So we'll start with Dr. Sumana of USAID. So I don't see people who raise their hands. Can you see them?
Hello?
Hello? Go ahead, Dr. Sumana. Yes. Hello, everybody. Thank you for the AmplifyPF team and for the collaboration. The results are very encouraging, and we can only thank you for all you have done, and we hope that the partners who are present will learn from what we have been doing and help us move ahead and go forward in our path. I have a few questions that I put in the chat box. The first one is, we talked about the cost in Dr. Asma's presentation, and I'd like to know about this cost. Is it for one CTAR or for all 5 CTARs overall? The second question is, if you look at the overall situation in this approach, I'm wondering whether, like, according to to you who implemented this approach, does it mean that the CTAR are sustainable even after the end of the project? And what do we need to do to make them ensure durability and sustainability with the help of technical and financial partners to go beyond the end of the Amplify project? And if overall, if we tell them you have another chance to duplicate, reproduce this approach somewhere else, what would you do to accelerate the best way to mobilize domestic resources as a result of the work done by the CTARs? Thank you. Hello? I hope you heard me. Yes, we heard you. Thank you, Dr. Asama, for the questions. And Dr. Sani, Dr. Asma, yes, thank you for these questions. So the first question regarding the cost, yes, it is the cost of implementation for one CTAR. So when we talk about the some millions of francs, there is the general assembly and the training that use a large part of this budget. But once it's organized and the training has been implemented, it's 234,000 francs per us as part of the advocacy efforts. So it's much less onerous activity. So the other question is, can CTAR replace the COGES and work after the end of the Amplify project? So I think what we hope is that, yes, that because it was part of what we had been hoping from the beginning, but now we notice that the CTAR generated more outcome, more results than the COGES, thanks to the approach we implemented. So maybe it's a discussion we should have at on a different level, but for us as partners, we cannot say that the CTAR will replace COGES, but we share the result of what CTAR has done, and it's up to the country to decide if it wants to be raised to scale in the entire country. It's not up to us to decide that. But we have written an advocacy document for the implementation of CTAR, which shows what we have done if someone wants to replicate what we have done in a different healthcare district or region. So we can talk about the impact of the project, and we are discussing with various stakeholders to see if we can replicate this approach. And then, if it's the case, what should be changed? If I understand the question correctly, this is what we should decide. What can we do if we can further improve mobilizing resources? I would say that in the first stage, it is one of the first things to do, because when we started work, we started by organizing roundtable discussions. We wanted to convene various partners around tables in order to talk about mobilizing resources, but it didn't really work very well in the level of Niamey. We tried to organize those roundtables, didn't really work. It's later, and we changed strategy by organizing guided tours, which enabled stakeholders to see what the needs were, and that worked much better. And then we started to generate actual results. Thank you. I hope I answered all the questions. Thank you. Dr. Asma, may I add something to the answer of Dr. Asma? Sani? Yes, go ahead. Yes. So this issue of CTAR and COGES on a conceptual level, we saw that there is some overlap between the role of COGEST and CTARs, but we saw that the roles also quite distinct, quite different, because COGEST is really a committee for the management to support healthcare services. So CTAR is more intended to mobilize resources to help healthcare facilities. So the targets of the two organizations are somewhat different. In the future, maybe we can make them more similar and integrated, but we still think we need to have a group that is targeting mobilization of resources for the healthcare system. Thank you. Thank you, Steve. And I want to add something. I see that CTAR is like an armed part of the COGES that helping finding more resources. Agima, Dr. Agima, you had a question? Yes. Thank you, Dr. Stani. I just wanted to add something about this question: how the COGES could be replaced by CTARs? Personally, I think that the reflection we should develop should be at the ministry level, because we support the health system. We try to think and ask the question, how can we put in place more efficient structures? Because we have seen that CTARs, there are fewer members. It's easier to organize meetings, and this structure is able to obtain financial resources to support the system. But at the level of a COGET, are there meetings of the COGET? Are there structures which are easy to manage? Do they cost less money? And can they really operate efficiently? Because the question we have to ask is the COGES, those committees, how often do they meet? Are they really efficient? Because one of the problems that we noticed is that we have noticed in 4 countries that there were COGES which did not have meetings because of the large number of members, and there was not enough. There were not enough funds to make these meetings possible. So it is up to the ministry to think, the health ministry, to think about a way to see whether the CTAR will be a subcommittee of COGES, or will we need a reform of the COGES to be done in the future. It is up to the health ministry to decide in each country to lead this reflection. Thank you. Thank you, Dr. Asama, for this clarification. Oh, there's a raised hand, another raised hand. Zacchaeus, allez-vous? Bisala? Yes, you have the floor. Can you, you're on mute, and give the name of your institution, please?
J'ai une erreur là. OK, il y a Marie-Guetou Compaoré.
Marie Compaoré.
Madame Compaoré, vous pouvez activer votre micro.
Madame Compaoré, vous pouvez activer votre micro, s'il vous plaît. Please activate your mic. No? Dr. Koudi Boja, Jude? Thank you so much for giving me the floor. My name is Koudi Boja Jude. I work for Pathfinder as the advocacy manager for French-speaking Africa. So I posted my questions. I asked 3 questions or 3 concerns. but there are more next steps. First concern, have you tried to link the country's commitment with international platforms, such as the African Union, with regards to specific politics, or the Maputo Plan? Have you linked between the successes you experience within this project and how those successes help our countries to get those successes or to reach out to those agreements? And in everything that we do, does it help in everything that we do? How does it help to reach our goals? The second question is, how are we capitalizing on what we have accomplished? And how these data were included into the reports, the international, national reports, and how are they being leveraged? And the third concern is, how do we leverage these results in such a way, how they leverage so that they can be duplicated in a different country, in another country? So those are my 3 points, 3 concerns, which are also suggestions or more inputs regarding next steps, even if they haven't happened yet. Thank you so much. Thank you so much, Kudi, for these relevant questions. Maybe Dr. Adiba can answer these questions on the regional level, because I think those questions are concern Amplify on a very global level. So, yes, you have the floor. Thank you so much. Can you hear me correctly? Yes, we can. Very well, actually. My name is Agima Tankwano. I'm Regional Director of Amplify Family Planning, which covers Burkina Faso, Côte d'Ivoire, Niger, and Togo. And so this experience, which was presented by Dr. Asma today, the same experience has been implemented in 4 other countries. So to answer your question, Mr. Joes, yes, this is being leveraged. We have a documenting plan, and we are finalizing the documents of different approaches. We think those are successful approaches. I think the best person to answer this question is the technical director. But I just wanted to say that we actually perform the documentation. This is something that we can share with other countries, because USAID demands that we document our successful practices so that they can be shared. In addition to these webinars, we will also organize a regional workshop to share these specific experiences in the sub-regions, so in those 4 countries. Now, with regards to technical support, of course, it depends of our mandate. Of course, this project is, it's financed by USAID, led in specific countries. So if you need this specific expertise, I believe this expertise now lives with Pathfinder, and whether Pathfinder Niger, Côte d'Ivoire, and Togo. And this expertise does exist and can be shared and can be support. But there's other financial institutions that can finance it. Now, do the countries leverage that in their report? We support the health districts, and everything that is generated through this project, it happens on the district level, on the health district level. So now, for that reason, I'm going to give the floor back to Dr. Asna so that she can explain how the PF in Niger now owns those aspects. Thank you so much. The technical director, Dr. Atamo, can also bring some further information, but I believe Dr. Sani is the one in Niger who is probably the better person to answer these question in Niger. Thank you so much. Thank you, Dr. Aidima, for this great contribution. Dr. Sama? Thank you so much, Dr. Sani. The project supports the health districts. So everything that has to do with annual planning, those are integrated into our plan of actions. And we support them, but it's the health district that plans in their action plan what they are going to do for a specific year. And the family planning unit works with the technical team as well. Thank you so much. Thank you so much. Are there other raised hands? Because we're getting close to the end of this webinar. 3 hands. I'm not sure we will be able to answer all the questions. Mamoudou Badi? Mamoudou Babi, you have the floor. Okay. Abdullah Husseini. Can you hear me correctly? Yes, very well. Go ahead. Thank you to the Amplify team and Dr. Sani and Dr. Asma and Steve. I'm thrilled to hear and listen to these testimonies and these innovations, these accounts for Amplify Niger. I would like to mention something on how to leverage and share these best practices with other countries. I'm in charge of research and coordination of the Ouagadougou partnership. And the topics that came out in those countries is that resource mobilization is a challenge, especially on a domestic level for health ministries. And we need evidence. We need supporting evidence so that we can ask for those resources. What you've just presented is a beautiful initiative. And I believe there's a significant interest. It would be a very common interest to share these best practices beyond the Amplify countries. Many countries would deeply benefit from these successful models. You talked about accountability as well. There's also accountability for Amplify, but also for health ministries, because this innovation needs to be properly documented and it needs to be shared. So it's something that needs to be leveraged by the Ministry of Health so that the projects can go on. I also understood that on a community level, the beginnings of sustainability are visible. So I believe this is all happening on an institutional level, and we need to focus on that so that this innovations, so that ministries leverage these innovations and they make it become more sustainable. Let me add something else. There are other organizations in the sub-region that could assist on the implementation. I'm talking about ExpandNet, for example, that has a financing in the sub-region, and they could potentially help ministries, but also partners, and they could help them scale things up. Those organizations should be leveraged to amplify this successful initiative. I think we are at time. Thank you so much for this contribution. We are going to conclude. I'm now going to give the floor to Stephen, who will give us words of conclusion. Thank you so much. So, to sum up, CTAR is a great tool to mobilize resources, and it has it was a significant help to health districts. It helped provide sustainability and scaling up. So those are points that we really need to remember with those experiences. Now, I'm going to give the floor to Lassana for final words. Thank you so much, Stephen. So this is the second webinar. Thank you so much for your participation. The next one will take place on May 18 on the experience of Amplify projects family planning with the circle of works and to promote sexual and reproductive health. We will hope you will join us at that point. Thank you so much.